this is a really common thing. How many of you guys have thyroid, goiter, nodules, cysts, and cancer? What are the signs and symptoms of low thyroid? Okay. And we're going to make this a game, and I'm going to have everybody in chat get ready. Okay. We're going to call it Capture the Spider. Okay. Imagine each of your finger is one leg of a spider. Okay. And I'm just going to read off some of the, at first, common symptoms of low thyroid, and then I'm going to get into some of the more uncommon symptoms. When you get to capture at least eight, you've captured the spider, and I want you to write spider in chat, okay? And then the other thing is that at any time, if there's a symptom that you're hearing that you had no idea was even related to the thyroid, think about, make a mental note, even write it down, what that symptom is, and then put it in chat, because you'd be shocked how many of the people don't realize that these other symptoms are really also common, right? The uncommon is actually really common. So we're going to go ahead and get started with a spider game. Capture the spider, everybody. So imagine and start going with your fingers right now. I want to see who's going to read spider first. It might be when I get to number 8 already. But number 1, fatigue. How many of you are tired? And I'm not just talking about physically tired, but what about brain tired? And how many people have something called chronic fatigue syndrome? Or that you're told that even months after something, like I was, 8 months postpartum, and I was exhausted, and I was told, that's just normal. You just had a baby 8 months ago. Fatigue, okay? Number 2, weight gain or difficulty losing weight. How many of you look at grass and feel like you gain weight, right? That's the kind of stubborn weight gain that I'm talking about. Kathy's like, I know what you're saying.
I just have to say, I don't look at grass and gain weight. I look at ice cream and gain weight. I look at cookies and gain weight. Grass is not really a problem for me, but I don't know. Maybe that's a problem for you, Doctor.
For people with low thyroid, the feeling is I could just look at the grass outside and I'm gaining weight. That's the kind of weight gain I'm talking about. So that's number 2, right? Number 3, we're talking about cold intolerance. How many of you have cold hands, cold feet? You feel cold all the time. Everybody else doesn't. How many of you have icicle feet in the bed, right? Just saying. I'm still going right now. Number 4, dry skin and hair. How many people have really dry hair, scalp, dry skin, right? You have eczema, right? Number 5 still revolves around the hair. How many of you losing hair or have periods where you really shed a ton of hair, or you look in the bathtub and there's all this hair all the time and you look at it and it freaks you out, right? You know something is wrong, right? That is not normal. And another thing is mental health changes, whether it's periods of depression, anxiety, brain fog, poor focus, ADD, ADHD, right? You name it. How many are on that list, right? Number 7, memory. How many people struggle with memory and really have problems with concentration? And then heart and blood pressure. How many people notice that their heart rate is slower? Or interestingly, how many people have fluctuating heart rate, where it goes fast and slow, fast and slow, fast and slow? We call that palpitations. So it's not just slow heart. In fact, the most common symptom I see is palpitations or even tachycardia, which is fast heart rate, which is why people with POTS, dysautonomia, with that fast, slow heart rate thing, oftentimes, almost 90% of the time, have a thyroid issue underneath. Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training.
Spider, by the way, people are starting to get the spider now with 8 of your symptoms already.
We're at number 8 and we're already at 8. Oh my gosh. Agnes. I love it. Okay, great, right? And we're not even halfway there. Think about this. What about constipation? And it's not just constipation. How many of you have alternating diarrhea in constipation? How many of you have severe heartburn? Right? How many? I mean, seriously, right? How many of you feel like food takes a while to move, right? As if it's stuck, right? How many of you swallowing problems?
Yes.
Trouble swallowing. What about hoarseness in your voice? These are low thyroid symptoms, right? Puffy face. What about muscle aches, body aches, right? How many people muscles feel just weak? Right? It's weaker than it used to be. You go to the gym, you try to do the same exercise, but you're weaker and you don't recover as quickly. How many has that happened? And then how many people had infertility and struggles with pregnancy, right? Thyroid, okay? And then neuropathy, nerve problems. How many people have nerve problems, right? Pain in your nerves, numbness and tingling, burning, right? And then last but not least, these are the most common. This is a really common thing. How many of you guys have thyroid, goiter, nodules, cysts, and cancer.
Yep.
By the way, do you guys know how many times people have thyroid cancer and haven't even been told that they have a thyroid problem? Oh, you just have thyroid cancer, but you don't have a thyroid problem, right? There we go. We got a ton of spiders here, right?
There are spiders crawling everywhere. There's lots of them.
Right? So I just want to show you guys just how big of a web that this thyroid is really a spider throughout an entire body. And was there any like symptom that really shocked you, right? Or were you ever told that with these symptoms, how many of you with spiders or with many of these symptoms was told your labs were normal and you don't have a thyroid problem?
Yeah.
Worse yet, was told you don't have a thyroid problem. Okay.
Or how many people have been diagnosed with another chronic condition like fibromyalgia, and it's actually a thyroid condition, that an undiagnosed thyroid condition.
Ooh, you're making me okay. So we have a ton of alumni. Heather's raising her hand. I love it. But like think about this. In the program, this happens all the time. We deal with people with all sorts of every autoimmune disease on the planet. We have people with POTS, mast cell activation syndrome. Those of you with POTS or dysautonomia, where you have the heart and slow heart rate, positional change, you feel dizzy and faint, right? And you got the blood pressure changes. I can't tell you how many times I've had someone come into our program, Transform Fundamentals program, to find out that their thyroid, their TSH was normal, but when they actually got the comprehensive thyroid panel with us and they actually learned about it, their thyroid was completely in the shitter. Like shitter. I'm talking about, I don't even know how this person is walking. How many of these POTS and dysautonomia patients are actually hidden thyroid problems?
Mm-hmm. So many. I mean, the comments are coming in faster right now than I can even keep up with because everybody's saying yes, 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 yes.
Right. And it's not, I mean, and I think about it too. I mean, the association between thyroid and other diseases is so high that it's rare for me to see someone, for example, like who's a diabetic or someone who has rheumatoid arthritis or someone who says I have the C word, long haul. Someone says I have chronic Lyme, chronic fatigue, I have neuropathy, who doesn't have a thyroid problem. Hey, if you really enjoyed what you're watching and you want to learn more about this topic, make sure you check out, if you're on YouTube, some of the suggestions for what to watch next right here. And if you're watching on any other format, feel free to comment in the comment section. Our team and I will get those resources to you. And if you haven't clicked subscribe yet on YouTube, make sure to click subscribe and ring the bell so you get notified every time we are live. Thanks, everyone.